Morning students, today's class we will see about the asepsis, their types. Asepsis is the condition of being free from disease-producing microorganisms. A aseptic technique implies all those procedures that reduce or eliminate pathogens and their actions or minimize their area of existence. Confusion sometimes results from enormously thinking that medical asepsis and surgical asepsis are the same except one is used for medical ward and the other is used for surgical ward. This is not so. The medical asepsis all those procedures used to protect the patient and his environment from the spread of infectious agent. But the surgical asepsis all those procedures used to sterilize and to keep sterile any objects or articles that are to be introduced into a wound or a body cavity or that is to be penetrate the skin. The emphasis comes medical asepsis cleanliness, that is freedom from most pathogenic organisms. Surgical asepsis comes as sterility, freedom from all microorganisms. Purpose of medical asepsis to reduce the transmission of pathogenic organisms from one patient to another person. The surgical asepsis is to prevent introduction of any organism into an open wound on a patient or to a body cavity. Isolation. Medical asepsis patient with a communicable disease is separated from rest of the patients by room, ward or unit. Surgical asepsis patient requiring surgery is taken to an operating room of the hospital. Soon, the medical asepsis is on about the isolation unit is established and as contaminated. Everything within the zone of isolation is contaminated. Nothing goes out of the zone without being disinfected or wrapped in a clean cover to permit handling in a clean zone. Surgical asepsis is on about the site of operation or wound is established as sterile field. Once a sterile article touches an unsterile article, it is contaminated or unsterile. Only sterile articles are brought into the sterile field. Hand washing. Medical asepsis, the hands and forearms to be washed 1 to 2 minutes to remove surface contaminants and soil. The hands or arms are dried with paper towels. Surgical asepsis, hands and forearms are scrubbed for 10 minutes to reduce the bacterial count on the skin surface. The earlier it was 10 minutes, but the modern with the sophisticated use of the antiseptics and the sterile we can use for 2 to 3 minutes. To reduce the bacterial count on skin surface, hand and arms are dried with a sterile towel. Gowns. Medical asepsis clean gowns are worn to protect the worker. Inside of the gown is clean, outside of the gown is contact with the patient and his environment is contaminated. Surgical asepsis sterile gowns are worn to protect the patient from the worker. Outside of the gown that is in contact with the sterile field must be kept sterile. Status of the patient, medical asepsis reservoir of infection. Surgical asepsis is a potential host, that is other people, environment, other reservoirs of infection. Goals of medical asepsis confine disease organisms and prevent spread to others. Surgical asepsis reduce number of organisms and prevent spread of infection to others. Principle of asepsis. Only sterile items are used within the sterile field. All articles used in operation have been sterilized previously. Persons who are sterile touch only sterile items or areas. Persons who are not sterile touch only unsterile items or areas. If in a doubt of sterility about anything, consider it unsterile. Non-sterile persons avoid reaching over a sterile field. Sterile persons avoid leaning over the unsterile field area. Tables are sterile only at table level. Gowns are considered sterile only from waist to the shoulder level in front and minimum of the sleeves. In the edge of anything that encloses sterile contents is unsterile. Sterile persons keep well within the sterile areas. Non-sterile persons keep away from the sterile area. Sterile field is created as close to as possible to the time of use. Sterile areas are continuously kept in view. Destruction of integrity of microbial barriers result in contamination. Moisture can cause contamination. When microorganisms cannot be eliminated, they must be kept to irreducible to minimum. Aseptic technique. Aseptic technique is a discipline that consists of a series of events to guard the patient against infection. This procedure is used to reduce the direct or indirect transfer of germs to any surface article or person. With a traumatic wound which are assumed to be contaminated beforehand, aseptic technique refers to applying a dressing in a manner so that additional contamination is not induced. In administration of preparations by injections or infusion, it refers to measures designed to prevent or minimize introduction of pathogen beneath the skin. In surgery, normally implies sterile conditions in and around the patient area. Treatment by personnel can carry out aseptic technique by keeping the hands clean and free from the contamination as possible, ensuring that all sterile items are kept free from all organisms, keeping from breathing, coughing, sneezing on wounds or sterile items. Medical asepsis. During the daily routine care, the nurse uses the basic medical aseptic technique to break the infection chain. For example of medical asepsis, changing the client's bed linen daily, hand washing, barrier methods, and routine environmental cleaning. Follow isolation technique as possible. Appropriate clients with high susceptibility to infections require special precautions to prevent exposure to pathogen. Effectiveness of aseptic practices depends on nurses' consciousness and consistency in using effective antiseptic technique. Hand hygiene is an important in every setting, including hospitals. It is considered one of the most effective infection control measures. Any client may harbor microorganisms that are currently harmless to the client yet potentially harmful to another person or same client if they find portal of entry. It is important both nurses and clients' hands be cleansed at the following times to prevent spread of microorganisms. They are before eating, after using bedpan or toilet, and after hands come in contact with any body substances. For a routine client care, WHO recommends hand washing under a stream of water for at least 20 seconds using plain granule soap or soft filled sheet or liquid soap when the hands are visibly soiled, after using the restroom, after removing the gloves, before handling invasive devices, and after contact with medical equipment or furniture. However, the soap and water are inadequate or sufficiently to remove pathogens. The Center for Disease Control recommends use of alcohol-based antiseptic hand rubs that rinse and gels or foams for the use of before and after direct client contact. Any microbial agents are usually provided in high-risk areas, just newborn nursery. Hand washing. The purpose of hand washing include to reduce the number of microorganisms on the hands, to reduce the risk of transmission of microorganisms to the clients, to reduce the risk of cross contamination among the clients, to reduce the risk of transmission of infectious organism to oneself. Assessment. Presence of factors increases susceptibility to infection and possibility of undiagnosed infection. Use of immunosuppressive medications. Recent diagnostic procedures or treatments that penetrate the skin or body cavity. Current nutritional status. Signs and symptoms indicating the presence of an infection. Localized signs such as swelling, redness, pain or tenderness with palpation or movement, palpable heat at the site, loss of function of affected part, presence of exudate. Systemic indications as fever, increased pulse, respiratory rate, lack of energy, anorexia, and enlarged lymph nodes. Equipment, soap, running water, and disposable or sanitary towels. Preparation. The nails should be kept cut short. Natural nails are less likely to harbor microorganisms, scratch a client, or puncture the gloves. Remove all jewelry. Microorganisms can lodge in the settings of jewelry and under rings. Check the hands for breaks in the skin. A nurse who opens sores may require a work assignment with a decreased risk of transmission of infectious organisms due to the chance of acquiring or passing of an infection. Performance. Turn on the water and adjust the flow. There are 5 types of set controls that hand operated handles, knee levers, foot pedals, elbow controls, infrared controls. Adjust the flow so that the water is warm. Warm water removes less and protective oil of the skin than hot water. Wet the hands thoroughly by holding them under the running water and apply soap to the hands. Hold the hands lower than the elbow from the arms to the fingertip. Rationale is that water should flow from the least contaminated to the most contaminated to the area. The hands are generally considered as the contaminated than the lower arms. If the soap is liquid, apply it to 3 ml. If the soap bar, rub them firmly between the hands. Thoroughly wash the hands and rinse the hands. Use firm rubbing and circular movements to wash the palm, back, wrist, and each hand. Be sure to include the heel of the hand. Interlace the fingers and thumbs to move the hands back and forth. Continue this motion for at least 15 seconds. The rationale is that circular action creates friction that helps to remove microorganisms mechanically. Interlacing the fingers and thumbs clean the interdigital spaces. Rub the fingertips against the palm of the opposite hand. Rationale is that nails and the fingertips are commonly missed during the hand washing. Rinse the hand. Thoroughly pat dry the hands and arms. Dry hands and arms thoroughly with a paper towel without scrubbing. Rationally, moist skin becomes chapped readily, as do as dry skin that is rubbed vigorously. Chapping produces lesion. Discard the paper towel in appropriate container. Turn off the water. Use a new paper towel to grasp the hand-operated control. Rational, this prevents the nurse from picking up microorganisms from the frozen handle. Thoroughly pat dry the hands and surgical hand washing. Apply the soap and water wash as directed, but hold the hand's finger higher than the elbows during this wash. Wet the hands and forearms under the running water, letting it down from the fingertips to the elbows so that the hands become cleaner than the elbows. Rationale is that in this way, water runs from area that is now fewest microorganisms to the area relatively greater in number. After washing and rinsing, use a towel to dry one hand thoroughly in a rotating motion from fingers to elbow. Use a new towel to dry the other hand and arm. The clean towel prevents transfer of microorganisms from one elbow to the another. Supporting defenses of sustainable host, people are in contact with microorganisms in the environment. Normally, a person's natural defenses enough to prevent development of infection. Susceptibility is the degree to which the individual can be affected, that is, likelihood of organism causing an infection in that person. The following measures can reduce person's susceptibility: hygiene. Intact skin and mucous membrane are on the one barrier against the microorganism entering in the body. Second is the nutrition. A balanced diet enhances the health of all body tissues, help the skin intact, and promotes the skin ability to repel microorganisms. Fluid. Fluid intake permits fluid output that flushes out bladder and urethra, removing microorganisms that could cause infection. Sleep. Adequate sleep is essential to health and renewing energy. Stress. Excessive stress predisposes people to infection. Next is immunization. The use of immunization has decreased the incidence of infectious disease. It is recommended that immunization begins shortly after birth and completed in the early childhood except for the boosters. Surgical asepsis. Sterilization destroys all microorganisms and the spores. Surgical asepsis demand the highest level of aseptic technique and require all areas to be kept free from possible of infectious organism. In surgical asepsis, in an area of object may be considered contaminated if touched by an object if it is not sterile. A nurse work with the sterile field or with the sterile equipment must understand that the slightest break in technique results in contamination. A nurse in the operation room follows a series of steps to maintain sterile technique, including applying mask, protective eyewear and a cap, performing a surgical hand washing, apply sterile gown and gloves. These techniques can be practiced by nurses in the operation theatre or the bedside by inserting IV or urinary catheter and reapplying sterile dressing where the sterile instruments and supplies are used. Control or elimination of infectious agents by cleansing. This is the removal of all foreign materials as oil, soil, organic material from the object. Generally, cleansing involves use of water, mechanical action with or without detergent. Disposable object has to be discarded. Reusable object must be cleansed thoroughly before disinfection and sterilization. When cleaning the equipment that is soiled by organic materials such as blood, fecal matter, mucus or pus, the nurse applies mask, protective eyewear, waterproof gloves. These barriers provide protection from infectious organisms. A brush, detergent or a soap are needed for cleaning. Thank you. Thank you for listening.